So Nadia, before we even start, one thing I do tend to hound people about is what are your qualifications?
So I'm an esthetician, so I've been in the industry for about 15 years.
Okay.
So I trained 3 years MVQ level 3 beauty therapy, and then I did advanced courses in all the machinery that they use these days, and then another advanced course in laser, IPL, and a training course as well.
So basically, you know your beans.
A little bit, yeah.
Okay, good. Can I tell you what I'm worried about
Yes.
at the moment? I'm 49,
Okay.
I'm going to be 50 this year, and it's really interesting for me to see how my body and my skin and my face is changing. 3 areas of concern for me that are starting to bug me.
Yeah.
The skin on my face, I've got makeup on today, obviously, but the skin on my face, I'm starting to get really bad. I don't know whether it's rosacea or sort of like thread veins on my cheeks.
Yeah.
I've got this really weird like dark lip thing going on
Yeah.
that's suddenly appeared. I don't know if you can see, but I've got these sort of brown spots that are starting to come as well. And I don't know whether I need laser, I don't know whether any of that can be dealt with cream or skin treatment. I don't really know what's going on because I used to have amazing skin.
Yeah.
So that's a bother for me. The other thing that's happened is I'm going through the menopause, so I'm a little bit sort of heavier, the weight distribution's changed for me, but I'm getting these really odd, like pimply bits on my upper arms as well that bug me because I can't quite get rid of them, even with sort of moisturising. Again, I don't know where they've come from. And then just in terms of the rest of my body, lots of cellulite appearing. Never had cellulite in my life. But everything feels quite loose and starting to go quite lax.
Okay.
Bigger tummy, bigger thighs.
Okay.
Despair.
Okay. Well, there's a lot we can do, but before I go through anything, it'd be alright if I can have a little look at the area, and then we can go through.
Are you ready for that?
I am. I've seen a lot worse.
Have you? Good. Well, you say that, you've not even seen even the clothes off yet. Okay, yeah? Should we do that?
Yeah, let's
Brilliant.
have a look.
Okay, so here's the problem I've got. As you can see, I used to have really, really strong legs.
Okay.
No cellulite or anything, and suddenly I've got it's just really weird loose skin.
Okay, let's have a little feel. Have you tried any treatments before on this
I have.
area?
I've tried Cool Sculpt.
Okay.
So I've tried to freeze the fat off. No difference whatsoever.
Okay. And how long ago did you try that?
I tried one about 6 weeks ago.
Okay.
I've tried it about 3 years ago. So I have tried it, and it for some reason just doesn't work on me. But I know that I've heard good things about Cool Sculpt.
Cool Sculpt is amazing. I mean, there is a very tiny % of the population that it just doesn't react on.
Classic.
You're probably in that tiny %. But I can definitely see you've got a tiny little pocket of fat just at the top of the thigh.
Right.
And then you can see where the skin has become a little bit more lax, causing the cellulite.
Why does it do that?
It's the aging process. So if you pop your trousers up.
I've got my bum's not too bad though.
No, you've got a nice bum. No cellulite on there.
Spots?
Yes, so this we can address.
What do you mean yes? I was hoping you were going to go no. It's lovely. Right.
There's a few little ones, but we can address that when we address your arms as
Okay.
well.
Can I pull my trousers?
You
up?
can.
Okay.
So the reason why this has happened, obviously, as you get older, your collagen fibers start being a little bit lax. So say this is your skin, these are your fibers.
Yeah.
So when you're nice and young, they're nice and upright. As you get older, they start to bend slightly,
Okay.
causing the skin
To droop.
to droop, okay, unfortunately. So there are a few treatments on the market that I can recommend that stimulates the collagen fiber to ping back in its upright position.
Okay.
Okay, there will be a course of treatments just because we need to maintain that stimulation so that the fiber then remembers to stay in that position.
So when you say a course of treatments, how many? So what's it called? This particular?
Okay, so the treatment is Exilis that I would
Exilis.
recommend for your inner thighs.
Yeah.
You need between 6 and 8 sessions on your inner thigh
That's
area.
a lot.
It is, but you'll get a nice result. It's like a 2-in-1. So it's a radio frequency tightening with an ultrasound cavitation fat burn. What does that mean?
Okay, what does it mean?
So where you've tried cool sculpting Cool sculpting freezes the fat cell until it dies and it comes through your waist system.
Okay.
Because you wasn't very responsive to that, we're going to try the opposite. So we're going to heat the fat cell until it dies, and then it will come through the waist system.
Okay, so obviously you've used Exilis quite a few times
A
before.
lot, yeah.
Have you had good results with it?
Amazing results.
Oh, really?
Yeah, definitely. We've had patients that have suffered from strokes where one side of the body has drooped, and we've managed to just treat that side to balance
Wow.
the body back. Yeah.
So it's a sort of two-pronged attack of heating fat cells
Yes.
so that your body eliminates them,
Exactly.
whilst at the same time tightening the collagen to tighten the skin.
Exactly.
But that's got to be around 6 treatments.
Yes, and the treatments have to be between 1 week to 2 weeks apart because we need to maintain that stimulation.
So that's a commitment.
It is a commitment. Results will be seen 3 months after the treatment, and the results will last 2 years.
That's interesting.
Yes.
So there's you know, sort of semi-permanence to that.
Yeah, definitely. And then after 2 years, it's not going to droop right back to how it was. You just need to maybe come in for a couple of sessions just to ping it back up again.
What's your confidence level with this then, with Exilis? Do you think, I mean, having seen, you know, the way my legs are and the laxity of the skin, do you feel confident that you're going to get a result?
Definitely. I think you'll definitely get a minimum of 70% improvement
Oh, wow.
in that area.
Well, I'm well up for trying that because
Yeah.
for me the Cool Sculpt absolutely hasn't
Yeah.
worked at all. So yeah, I'll definitely try the Exilis.
Okay.
Thank you.
Shall we have a little look at your arms? You said that was a concern.
Okay, so let me do this. Basically, what's happened is, even though I've put moisturiser on, I've got these really weird sort of pimply spot things on my arm. I hate it,
Okay.
and I don't know how to get rid of it, and I don't know what it is.
How long have you had it for?
Oh, probably while I've been perimenopausal, so I'd say, good three years.
Okay. There's a really, I mean, this is a very, it's not a severe condition at all, it's a very light condition. So there's a condition called Keratosis Pilaris, which is basically little calcium and keratin pustules under the skin. So they cause these little bumps on the upper arms, some people get them on the thighs and on the buttocks as well. It can be caused by numerous things. Hormonal is a big...
Really?
Yeah, definitely. And also if you've ever gained weight, lost weight, gained weight,
Really?
it just the body holds on to a lot. Where you've got your hair follicles as well, that's where everything collects, and that's why it feels quite bumpy.
So what can you do about that?
A body lotion with a great like glycolic or an AHA acid in would be amazing for that.
Oh, I
area.
see. Okay, so use acid to exfoliate and get them off.
Yeah, exfoliating as well with a scrub, like once or twice a week, would really help. And like I said, you could do that on your buttocks as well.
Oh, my bum as well. I never get to see my bum. So, but now you've very kindly told me that you've got some issues there as well. Fine, I'll use that. Do you guys recommend a body? Because I mean, I do use lotions. I do scrub. It's made no difference for me.
Scrub it. A scrub, you can use any scrub.
Yeah.
Or you can go for again a glycolic acid scrub.
But where'd you get that from?
So Zeo Skincare, so Abaji, do an amazing body emulsion and a body scrub where you can, it's very highly concentrated in lactic and glycolic acid. So that will really help micro-exfoliate the area.
Okay, so you'd recommend a professional skincare?
Yes, something a bit more clinical rather
Right.
than a mainstream body lotion.
Okay, and that will get rid of those weird
Yes.
pimply milk spot things?
You do have to use it every day.
Oh, really?
Yes.
So again, it's a commitment.
It's a commitment, but again, you will get the results in the end. At least you need to use it for about 2 months before you start really seeing a difference.
Okay, all right.
Okay, so going back to your skin, so you told me you've got a little bit of redness and thread veins here, and you've started noticing a bit of pigmentation on the upper lip and a couple dotted on the face.
Oh, jeez, yeah.
as well. So there's a few ways we can treat this. So we can take an IPL treatment approach.
So laser.
Yes. So IPL is intense pulse light therapy. So we can treat the redness and the thread veins on the face with that. It depends how deep the thread veins are. If they are quite deep, you probably need between 1 to 3 sessions
Okay.
to kind of drift them to the surface, and then we can really zap them. Sometimes IPL doesn't work as well as other treatments. So sometimes it works, sometimes it doesn't. So it is a hit and miss
Which, do you know, and that's really hard, isn't it? Because if you're actually paying for IPL, and it's interesting that you've told me that, because I have had one IPL treatment. This is a few months ago. I went to a hospital actually and spoke to a skin guy there, and he did an IPL treatment. Didn't make any difference.
No result. Yeah. So the other approach is we can approach it with products. Okay.
Really?
Yeah. So clinical medical grade products have been proven to help with rosacea, thread mange, redness, and also target that pigmentation.
But how so? Because presumably to target the pigmentation, you've got to take off the layers of skin.
Yeah. So retinol is the biggest ingredient for pigmentation, for a anti-pigmentation approach.
So that's vitamin A, isn't it?
Exactly.
Okay.
And they come in different strengths. So I always say to my customers, you can take a low approach, medium approach, or a high hardcore approach.
Well, doesn't everyone just say, let's go for the high hardcore?
People do, but they don't know what comes after. So results-wise, if you go for a high approach, you'll see results in 12 weeks, so in 3 months. But there is quite a bit of downtime with the products because they are quite strong. So your skin will peel quite a lot, feel quite tight, be quite red. So the results will be amazing, but there is a bit, you have to be quite dedicated to going through that.
So these women that are doing that, do they work? I mean, are they literally going into the office
They do.
with a sort of beetroot face every day?
Yeah. It's very hard to wear makeup as well if you are peeling because it just doesn't stay on.
Okay, that's going to be, I can't do that. That's going to be a nightmare. I mean, I hear what you're saying. That's the sort of quick, hardcore approach, 3-month result. But then if you're walking around with a bright red face, you can't wear makeup. With the job that I do in particular, I'm going to be filming, so I can't do that.
So with a low approach, you're looking at up to a year before you start seeing a result.
But that's nuts.
So I think a medium approach would be good for you, and we throw in a little bit of a retinol as well. So your skin might be a little bit sensitive in the beginning, so for the first 2 weeks, and then the products will kick in and you won't have any of that, uncomfortable peeling or redness on the face.
So would you say for the first 2 weeks then, don't wear makeup?
You can
try not to go to premieres or
you can
TV
still
awards.
wear makeup. No, you can still wear makeup with the medium approach.
Okay.
But obviously your skin will have to it takes a bit of time for the cells to adjust to the products.
So I shouldn't worry about a feeling of tightness or redness or a bit of peeling?
Completely normal with a retinol. What I would like to probably do before I even put you on this routine is if we do a really deep cleaning treatment. So I would probably just do a hydrofacial on you to get all the gunk and all the dirt out first.
Yeah.
And then you go home and you put all the products in.
I love the sound of hydrofacial. Is that where you get to squeeze spots?
Yeah, definitely. We love that.
I'm right for that. And that's what you live for, isn't
it?
Okay, so deep cleanse first.
Definitely.
I'm up for it.